Yeah. So once the port pocket's in, then I will, ideally the tech is like tested and assembled the port and it's on the tunneler. So then I will tuck in the reservoir into the port pocket, and then I'll tunnel towards the neck incision. I try and have the tunneler where it's like perpendicular to the clavicle. I don't even know why I'm kind of a nut about that, other than I'm just a particular guy, and I don't know, maybe it's a better look for the port. I have no idea, but I feel like that's also something Bream told me to do. And ever since I've just carried that with me. But as I'm saying it out loud, I'm like, I don't know why that's important. So I tunnel with the dial or the tunneler perpendicular to the clavicle, and then I pop out the other end. Sometimes there can, one of the things I should mention is that like once you do your dermatotomy at the skin entry site, like up in the neck, I do dissect down. I dissect down to the vein, and then I turn that dissection back and I'll direct it towards the clavicle. That I think makes the tunneling a little bit easier. I do that for like ports and dialysis caths.
That's a good trick, because a lot of times it's hard to get through that hole, and then I end up taking a blade and trying to find my tunneler almost always. But that might actually help prevent that.
That for sure will help you prevent that. Yeah. Now you still have to like push that dilator around till you find that little cleavage plane, but it makes it a little bit easier. And I can't remember the last time I had to like dissect back or like, cut down on it. That's not true. I can remember the last time. It's not that long ago. It still comes up. And so then I tunnel, I pull the catheter kind of taut, and then now the reservoir is just sitting in that port pocket. I know the length of the catheter that's going to be underneath the skin. And, there's a little number where you can tell like how much of the catheter is in the chest wall into the neck. And then, if I can take everyone back to like that intravascular length that I had, so if I have 8 centimeters from the port reservoir to the skin entry site at the neck, and then I'm like, okay, my intravascular length is 20. So then, I have a 28 centimeter port. That's not actually a good number. It's usually like 15. Like I find most ports I cut between 20 and 25.
Okay. Yeah, that's about the same as me. Yeah. 20 to 25 is the magic. That is definitely the magic number.
So, right. There's an expression like measure twice and cut at 23. Yeah.
Right.
So then you have the port catheter sticking out. I don't take off the dilate, or I don't take off the tunneler. I'll just cut it to the desired length and then chunk that. I used to like put a little, do like a measurement on the external to the patient, just to make sure it like was in the ballpark. But I just gave up on that because I feel like my measurements are more on point than like actually just laying the catheter across and estimating it. So at that point, I only have the micropuncture sheath end. So then dilate, peel away sheath, and then, stuff the catheter, pull the peel away sheath, and then check and see if it's in the right spot.
Yeah, the only difference, like I said, I used to measure it with a wire, and then I started laying it over because I saw a colleague of mine do it. And I was like, oh, let's try that. And I just started seeing where, we talk about 20 to 25, and almost always it's like 22 to 23. So I just take some curved hemostats. I narrow my window on fluoro, and I just want to see that tip. I try and align it with where the sheath is, where I can see it. So it's not like an acute angle. So I try and align, and almost always it's like 22, 23, and I just cut it right there. And knock on wood, I haven't been disappointed yet with the layover approach.
I don't think there's like a right way and a wrong way on that. I think like the layover approach is perfectly fine.
Yeah, I think it shaved a couple minutes off my
There's no way it's shaved minutes off the procedure time, but yeah, maybe a little bit. But like that's the thing about ports. Like people always talk about speed of ports, and people will tell me like, even like the people that do ports really quickly, and they'll say they can do a port in 10 minutes. I mean, that's fantastic, but I don't mind taking 15 minutes on a port, or whatever. If I take 20 minutes on a port, my day is not like based off of the 5-minute increments that I can save.
No, I mean by spending the adequate time on a port saves you hours on the back end when they don't come back with their port exposed because you didn't stitch it up properly, or or it's just non-functioning.